This video will cover angioimmunoblastic T-cell lymphoma. The anchor for this video is this restaurant because its name sounds like T-cells, right? Additionally, since there is a green theme here, we're going to remember lymphoma since lymph things are usually represented in green. To help us remember the angio portion of angioimmunoblastic, just notice the decorations in this restaurant. Don't they look a lot like blood vessels? And lastly, to remember immunoblastic, let's just use the fact that some of the people in this restaurant look like they are immunocompromised, right? This actually leads into something really important about this lymphoma. These patients tend to have immune dysfunction, which can present as development of anti-smooth muscle antibody, rheumatoid factor, autoimmune hemolytic anemia, cold agglutinins, polyclonal hypergammaglobulinemia, among other conditions. Let's just remember that all of these conditions I listed are due to immune dysregulation, which again, we're going to remember by the fact that these guests here are immunocompromised. This is an EBV-associated neoplasm that affects middle-aged to older adults. If you notice, all of the guests in this restaurant are middle-aged to elderly. To remember EBV association, episode 5 of some show is playing here. As in other videos, episode 5 can be shortened to EPV, if you wrote the number 5 in Roman numerals. And EPV is almost just like EBV. But something important to remember is that the neoplastic T cells are EBV negative. The cells that are EBV positive are the B cell immunoblasts. This is represented by the fact that these guests in front of the TV are eating Brussels sprouts. The show also seems to be about Brussels sprouts in some way. As in other videos, Brussels sprouts represents B cells since they are round and start with a B, just like B cells. CD4 is expected to be positive in this neoplasm, and to remember this, let's notice this nice door here. This nice door represents CD4 because the number 4 sounds like door. CD8 is expected to be negative, and to remember this, just notice that there's no gate of any sort here. The word gate sounds like the number 8. T-cell receptor is clonally rearranged in most cases, and to help us remember this fact, look at this broken kiosk here. Aren't kiosks basically receptors? Okay, I feel like if I didn't use this prompt to remember this one, it would be a missed opportunity of a really easy prompt. This character here has got some pretty noticeable breasts. This is to represent the fact that TET2 mutations are the most common mutation identified in this neoplasm. I'm not going to explain this one. I'm going to let you make the association between her breasts and TET2. IDH mutations are also common, and this is represented by her t-shirt. Each first letter of each word here on her shirt ends up spelling out IDH, and that is what we're going to use. DNMT3A mutations may also be seen, and we're going to remember this by this one suspicious bag here. Maybe it's that one recreational drug that sounds a lot like DNMT, right? Again, I'm going to let you make the association on this one. This neoplasm is positive for markers of follicular helper T cells, such as CD10, BCL6, and PD1. CD10 positivity, as in other videos, is represented by this den here full of CDs, since the word den sounds like the number 10. Let's remember BCL6 positivity by this character's belt buckle, which seems to be made of sticks. Buckle will remind us of BCL, and the fact that it's made of sticks will help us remember the number 6, since they sound alike. PD1 is an easy one to remember because this is a police officer, and police officers work for police departments, which are often abbreviated as PD. Lastly, CD21 displays hyperplastic follicular dendritic cells in areas of infiltrated neoplasm. This is represented by the Tweety character, which sounds like the number 20, and Tweety is drinking a 21 plus beverage, so we'll remember CD21 this way.